You lift your arm to wave at someone across the street, and the skin on the back of your upper arm keeps moving for a second after your arm has already stopped. That loose, swinging motion isn't just something to feel self-conscious about. It's worth actually understanding what's going on underneath, because a few of the assumptions people make about it don't hold up. It isn't simply about carrying extra weight. It isn't something you're stuck with purely because of age. And it doesn't require an expensive clinic visit to start addressing. What's actually going on is a mix of connective tissue that's lost some of its usual give and fluid that isn't draining from the area the way it should. And there's a reasonable case that a few minutes a day of the right kind of attention can start to change that. I'm Joshua Smith, and if plain language breakdowns like this are useful to you, subscribe and hit like so more people find videos like this one. Here's what's happening in plain terms, no anatomy lecture required. Your skin isn't a single layer. Underneath the skin itself sits a layer of fat called subcutaneous fat, simply the fat sitting just beneath the surface. Below that is a thin sheet of tissue called the superficial fascia, which works like the body's internal wrapping material, holding everything roughly in place while still letting each layer glide against the one next to it. When those layers are well supplied with blood, they stay mobile and stay firm. When circulation to a specific area is consistently sluggish over months or years, the working theory is that those layers stop gliding as freely and start adhering to each other instead, a process related to what's sometimes called fibrosis, tissue that's thickened and become more rigid than it should be. The back of the upper arm is one of the least used muscle zones in ordinary daily movement. You bend your elbow constantly throughout the day, picking things up, holding your phone, carrying bags. But the muscle that straightens the elbow back out, the triceps, barely gets called on during normal activity. Sitting in that kind of movement blind spot for years, the thinking goes, means the tiny blood vessels feeding that area, the capillaries, slow down along with it. When blood flow through those capillaries slows in a region, fluid that would normally move in and out of the surrounding cells can start to pool instead, in what's sometimes called subclinical edema. Fluid retention subtle enough that you wouldn't necessarily notice it directly, just its effects. Combine tissue that's carrying extra fluid with tissue that's lost some of its gliding quality, and gravity does the rest. That's the sag you see every time you wave. Here's the piece worth understanding before getting into what to actually do about it. This doesn't appear to be primarily a fat problem. If it were simply excess fat sitting in one spot, targeted fat loss would solve it. And spot reduction of fat from one specific area isn't something that holds up under scrutiny. No cream, device, or wrap changes that. What the approach below is aimed at instead is the fluid retention, the layers that have stopped gliding against each other, and a muscle that's been underused for a long time. Address those three things and the tissue can tighten, not because fat was burned off it, but because the underlying biology supporting firm skin gets restored. The first piece of this is a simple self-massage technique. Find the back of your upper arm and take very small pinches of skin between your fingers, small being the key word. A large, deep handful barely registers. A tiny pinch of just the outer layers is what tends to produce a sharp, unpleasant sensation, especially the first few times you try it. That reaction isn't something to chase or push through aggressively, but it does reflect real differences in how mobile the tissue is in that spot versus other parts of your body. And it's a reasonable signal that this is an area where circulation has been limited for a while. What you're doing mechanically is encouraging some separation between the skin, the fat layer beneath it, and the fascia below that, nudging the tissue back toward gliding against itself the way it's meant to. Increasing blood flow to the area this way brings in more oxygen and nutrients, which supports the cells responsible for producing collagen, called fibroblasts, doing their job. Collagen is the structural protein that gives skin its firmness, and when fibroblasts have what they need, they can lay down more of it. Try this daily, gently, and don't force it past mild discomfort. Over the first couple of weeks, many people notice the sensation easing somewhat, which is a reasonable sign that the tissue is responding, not a signal to push harder. If you have a partner willing to help, there's a version of this you can do together, sometimes called skin rolling in manual therapy circles, where they lift a fold of the skin on the back of your arm and roll it along in a wave as they move down your arm. On tissue that's already mobile, this can feel almost relaxing. On tissue that's been stiff for a while, it can feel pretty intense at first, which again reflects how much the area has been sitting still rather than anything to be concerned about, as long as it stays at a tolerable level. With repeated sessions over a few weeks, most people find it becomes noticeably more comfortable, alongside visible changes in how the skin looks and feels. The second part of this addresses the muscle itself. A muscle that goes chronically underused for a long stretch of time loses tone, meaning the baseline tension it holds even at rest. And a low-tone muscle does very little to support the skin sitting on top of it. The most effective exercise for isolating the triceps specifically is a narrow grip push-up. And the technical detail that matters most is keeping your elbows tucked in close to your ribs throughout the movement. Flare your elbows out wide and the work shifts to your chest and shoulders instead. If a full push-up on the floor is too much right now, that's not a reason to skip this, it's a reason to start somewhere easier. Push against a wall at a slight forward lean first. That's a genuine version of the exercise, not a placeholder. From there, you can progress to a countertop, then a sturdy chair, then eventually the floor, adding a bit more demand at each stage. That gradual increase in load over time, often called progressive overload, is really the foundation of how any strength training works. As triceps tone improves, blood flow to that whole area tends to improve alongside it, and the muscle itself starts providing more support to the skin above it from the inside, working together with whatever progress the massage work is making on the surface. The third piece is stretching, and it isn't just something to tack on if you have time left over. A useful sequence here is to stretch the muscle briefly before you load it, do the strength work, and then stretch it again afterward. Part of the reasoning is that muscles tend to get better blood flow when they're moving between tension and length rather than staying in one position, and post-workout stretching is commonly thought to help clear some of the byproducts that build up during exercise and contribute to soreness, though the exact mechanisms behind muscle soreness are still debated. To stretch the triceps, raise one arm, bend it so your hand drops behind your head, and use your other hand to gently guide your elbow sideways and slightly back. You'll feel the pull along the back and outside of your upper arm. Hold that for 20 to 30 seconds. Leaning your torso to the side at the same time stretches the muscles along your trunk too, at no extra cost and time. One important caution here. The shoulder has a wider range of motion than any other joint in your body, and that flexibility comes with a trade-off. It's also one of the more unstable joints you have. If you have a history of shoulder injury, a dislocation, a rotator cuff issue, or ongoing impingement, don't push through pain during these stretches. Pain in a joint with a history of injury isn't something to muscle past, it's information. If a shoulder problem is limiting your daily life, that's worth a proper evaluation, possibly imaging, and a structured plan from someone qualified to build one rather than working around it on your own. The fourth technique uses arm swings, and it works differently from everything else here. Instead of a static stretch, you're using momentum, swinging the arm with enough controlled speed that at the end of the motion, the tissue gets a brief stretch that holding a fixed position can't quite reproduce, while the small effort of controlling and slowing the arm adds a touch of strength work at the same time. Keep the motion controlled rather than a hard whip, especially if your shoulders aren't used to this kind of movement yet. This combination of a brief, deep stretch with light muscular effort in the same motion is a big part of why similar movements show up in rehab and sports settings. It's worth zooming out for a moment, because none of this happens in total isolation. Collagen and connective tissue changes that show up on the back of your arm are part of the same broader aging process that shows up elsewhere in the body too, in skin elsewhere, in joints, and how tissue generally holds its structure over time. That doesn't mean loose arm skin is predicting some other specific problem, but it's a reasonable reminder that whatever supports connective tissue health generally, movement, nutrition, and catching genuine deficiencies, tends to help more than just the one area you're focused on. One factor that's genuinely worth knowing about here is vitamin D. It isn't only relevant to bone health, it also appears to play a role in how actively fibroblasts, the collagen-producing cells we mentioned earlier, do their job, and low vitamin D levels are linked in some research to reduced collagen production. Vitamin D deficiency is also remarkably common, with studies putting the share of adults with insufficient levels anywhere from roughly 40 to 80% depending on location and other factors. And people who spend little time outdoors, live at higher latitudes, are older, or have darker skin tend to be at higher risk. None of this means fixing a vitamin D deficiency is a cure-all, but for people who are genuinely low, correcting it is generally considered good for connective tissue and overall health beyond just the skin. The way to actually know where you stand is a blood test called 25-hydroxyvitamin D, a standard panel item your doctor can order. Some clinicians consider levels in the 50 to 80 nanograms per milliliter range optimal for tissue health, though recommended ranges vary. If you're below whatever range your doctor considers appropriate, work with them on a suitable dose rather than guessing or taking a large dose on your own. There's a safe range here, and staying inside it matters. Something worth sitting with is that the urgency of all this really does shift with age. Collagen production starts gradually declining sometime after 40, with the rate of new collagen falling behind the rate collagen breaks down, and by 50 that gap tends to become more noticeable. What this looks like for you at 35 is genuinely different than what it looks like at 55. If you don't mind sharing, drop your age in the comments. It helps me get a sense of where most people watching this actually are, so future videos can speak more directly to that. Here's the whole thing distilled down. A daily routine covering 4 pieces. A few minutes of gentle pinch massage on the back of the upper arm. Narrow grip push-ups progressing at whatever level fits your current fitness. A proper stretch before and after that push-up work, and arm swings worked in as a warm-up. Alongside that, get your vitamin D checked and address it with your doctor if it's genuinely low. That's really the whole protocol. No expensive equipment and no clinic visits required for most people. Just 5 to 10 consistent minutes a day and letting the underlying biology do what it's already built to do when it gets the right input. The skin on your arms isn't something working against you here. Think of it more as information about what's going on underneath, worth paying attention to rather than something to just cover up. If this was useful, subscribing and leaving a like genuinely helps more people find it.